Thank you for that introduction, Dr. Masaki. And thank you, all of you, for attending this segment. It's my privilege to be here with you, and I look forward to sharing this information with you. The topic we have today is revisiting an old and underappreciated medicine. I want to start by noting that medicine is a very forward-looking profession. And that's out of necessity because it's a constantly evolving profession. There's always new things developed, new ways of understanding disease processes, new ways of discovering new ways of treating our patients. And it's necessary. I go back to my first day of medical school where, like the first day of medical school in most medical schools, the dean comes and addresses the new students and invites them into the profession, welcomes them into the profession, says a few nice things about them, and then, of course, tells them that they're going to work very hard for the next 4 years because there's a tremendous amount of information that they're going to have to engage and assimilate. And then he says, or he or she says, you know, and a whole bunch of what you learn is actually going to be found to be not true, which is surprising for a medical student to hear. I'll give you a simple example. When I was a medical student and early in practice, peptic ulcers, stomach ulcers, were thought to be related to excess stomach acid. This was a medical dogma that was actually unquestioned at the time. And the medicines that were used to treat stomach ulcers were the highest selling pharmaceuticals in medicine. Well, today, we know stomach ulcers are not caused by excess stomach acid, but rather they're caused by bacteria. So the treatment is completely different. So medicine invites us to have the necessity is that we have a lifelong process of medicine, that we're always learning, and it's a huge undertaking. In this country alone, $170 billion a year is spent in medical research, occupying 120,000 medical scientists. And the result of that is very positive: new understandings, new treatments. But in our enthusiasm for what's new, we don't want to forget what's old. Like the Roman god Janus, we want to look both ways. We want to look to the future, but also look to the past and make sure we're bringing forth into the future, into the present, those therapeutic elements that we found to be useful, helpful in the past. Which brings us to our topic of today, which is an old and underappreciated medicine. What I'd like to do first is just run through the known therapeutic effects of this medicine. If you have high blood pressure and take this medicine, you have better control. If you're having surgery and this medicine is administered before surgery, you have less need for post-operative medications and better wound healing. In trauma situations, you have improved outcomes. You have longer survival in terminal illness. Back pain, reduced intensity. Migraine, reduced frequency. Irritable bowel syndrome, reduced symptoms. Diabetes, better glucose control and less metabolic complications. The common cold, you have a shorter duration of illness and a measurably more robust immune response. In depression and anxiety, improved outcomes. If you take an antidepressant medicine, along with this agent, you have an improved response. So it has wide-ranging effects. And of course, the question is now, what is this medicine? The medicine is compassion. Here defined as a process wherein the physician empathically is attuned to the patient's suffering and, importantly, is inclined to help. When those two elements are present, these therapeutic benefits are available. Now, I said it was an old medicine. How old is it? If we go back to Hippocrates, the beginning of Western medicine, 400 BCE, this quote: "The patient, though conscious that their condition is perilous, may recover their health simply through their contentment with the goodness of the physician." simply through their contentment with the goodness of the physician. To me, it's a rather provocative assertion. That is, there's something about the presence of the physician, the person of the physician, that has a directly healing quality. Now, of course, in 400 BCE, when an authority like Hippocrates says something like this, everyone believes it because he's the authority. We don't live in that world anymore. We live in the world of evidence-based medicine. In Edward Deming's words, "In God we trust, all others must bring data." For those of you who love data, who are interested in data, who want to take a deeper dive into the data, I would recommend this recently published book, which collates in great detail all of the evidence that we have that would support the assertion I'm making. That is, that compassion is an important part of medical care. So, what we might be able to conclude thus far is that compassion is an integral part of medical care, of every medical treatment. Whether it's brain cancer or whether it's acne, it should be present each time. It's like, analogously, if you go to buy a car and you think, well, I'd like to have a sunroof, but I don't really need a sunroof, or the car will work fine without a sunroof. I don't think that's the way compassion is to medicine, not optional. Rather, it's more like a steering wheel. All cars should have a steering wheel, and all medical treatment should include compassion, with the evidence that we have, or based upon the evidence that we have. And that the physician's presence matters. I don't know, when you take your laptop to Super Geeks to have it fixed, I don't think it really matters if the technician loves your computer or not, or is empathically engaged with your computer. It'll probably get fixed just fine. But in medical treatment and treating patients, our presence matters. It has an impact on what happens. Now, I'm not saying to you that if you are a physician that has poor medical knowledge and poor clinical skills, that compassion will make up for it. I don't think it will. We should have well-developed medical skills, deep amount of medical knowledge. But I would suggest to you that if you took two physicians of equal skill and equal knowledge, the one who is more compassionate will have better outcomes in any field. So let's take a bit of a deeper dive into the phenomenon of compassion. I'm going to show you this video. It lasts for about 3 minutes. So watch the video and then we'll come back to our discussion. So what is being described here, at least in part, is the phenomenon of compassion satisfaction. That is this uplifted feeling we get when we're compassionately engaged with helping others. And it's possible that even in watching this video, you may have noticed that that's a physiological response. As the video performer suggested, a tear comes to the eye, a lump in the throat, your chest expands. It's really a wonderful feeling. It's an uplifting feeling that we get. And that we are hardwired for compassion, that when we are engaged in compassionate activity, our brains start to function in a particular way. There's increased activity in the ventral striatum and septal area. The reward centers of our brain start to become more active. And there's reduced activity in the amygdala. The amygdala being a place of a repository of the stress neurochemicals, or at least some of them. So that, as they say, we're hardwired to be compassionate. It's very reinforcing. So what's the net result of behaving in a compassionate way? Less stress, better health, more satisfaction. Which suggests, given the way medicine is practiced, that we should be the happiest profession on earth, because we have opportunities every day, over and over and over again, to act in a compassionate way. However, it's not so simple. This phenomenon of burnout, which we're reading everywhere now. 10 years ago, you never heard of burnout. Today, you hear about it so much that sometimes I get burnt out hearing about burnout. But in medicine, it's become evident that this is very, very common. And burnout is a simple syndrome. I'll give you the definition in just a moment. But any time that demands exceed resources over time, human beings will start to burn out. And in medicine, the demands are great. The medicine's time, hard work, long hours, lots to learn intellectually. But also, it's a very emotional profession where we are tasked with engaging day after day after day with human beings, oftentimes in the most emotionally intense moments of their lives, where there's sickness, where there's fear, where there's death. And we're entering into that environment over and over and over again, day after day after day. So in addition to all the sort of practical demands, the workplace demands, there's also just the demands of practicing medicine. So what's burnout? It's this syndrome with three parts. Emotional exhaustion. I'm just worn out. I've given everything. I have nothing more to give. Depersonalization. This syndrome where we become kind of numb and withdrawn, just kind of a little bit more robotic and mechanical in the way we are practicing and actually the way we're living. And a low satisfaction. Our work is not meaningful anymore. It's not very satisfying. The journey through medicine, through training and into practice is a long one. Most people minimally have done 4 years of undergraduate work. Some people have done master's degrees and PhDs, so they've done even more, years of study before they even enter medical school. Then you have 4 years of medical school, which are very rigorous and demanding. And then you have a minimum of 3 years of residency for most people, 4 or 5, or even 6 or 7 for some, depending on their career goals. So it's a long journey. And, we start off quite perky, actually. If you look at undergraduates matriculating into medical school, they are a very robust bunch of people. Better than average physical and mental health. They're enthusiastic, they're hardworking, they're motivated, and most of them are deeply caring. I mean, most of us are motivated to medicine because we care about people and we want to be of service to people. But medical school is tough. By the end of medical school, 40% of medical students are burnt out. Residency, 60% of residents are burnt out. That means the majority of residents, this is an average across all specialties, have burnout. And I wish I could tell you, that they should just hang on, go into practice, it'll all be okay. But burnout in practice is about 50%. So it doesn't just go away. So it's a big problem. And when burnout increases, compassion decreases. So that this medicine we're talking about becomes less and less available in physicians who are burnt out. And there are lots of physicians who are burnt out. So let's do something a little bit more. Let's do a little experiment. This image is of a painting by Vincent van Gogh. And the painting is entitled Sorrowing Old Man, or At Eternity's Gate. This particular painting, this image of this painting, was completed. This painting was completed about a month before Van Gogh died of suicide. So what I would invite you to do is just spend a few moments simply observing the painting, being open to the painting. Just let it affect you in whatever way it might. Just look at it for a moment. The point I'm trying to underscore here, or have you touch into experientially a little bit, when we are engaged in another person's suffering, mirror neurons in our brain start to fire automatically that mirrors this condition of the other person. So we directly feel the suffering of another human being. Either if it's in person or even sometimes when you look at a great master's painting, you can feel the suffering. And our brain starts firing in a way that's analogous to the suffering person. Obviously, in an image, this person's brain is not firing. And it happens automatically and unconsciously. This sort of phenomenon of emotional contagion starts to happen. So hold that in mind for a moment and let me share with you a vignette. And this story was told to me by a young physician, had been in practice for a couple of years, was working as a hospitalist, which is, a physician who's taking care of people inside the hospital in inpatient care. And one evening, when she was on duty, she was called to the emergency room to accept and transfer a patient who needed to be admitted, who was quite seriously ill. So this young physician goes down to the emergency room, and she finds herself greeting a young woman about her age who is quite ill. And she greets this young woman, explains to her what's going to happen. You're going to be admitted, and we're going to take care of you. And before the transfer could occur, over about the next 30 minutes, the patient's condition rapidly deteriorated, and the patient died in the emergency room. This young physician found herself overcome by this experience. This patient almost literally died in her arms. Someone who she'd been talking to just a very short time before. She excused herself, went to the restroom, and just sat and wept for a time. She composed herself, as we do, went back to the emergency room, and actually was met with a great deal of support. The support had a particular quality to it, though. She was met with the support, with the recommendations to, don't let yourself be so affected by this. Just let it go. Your other patients need you. We did everything we could. Just try not to let this affect you, which in and of itself is not bad advice, but it has some limitations. If we look at situations where we are coping with distress, especially emotional distress, if it's too much, we start to feel overwhelmed, as this young physician did. And she intelligently withdrew herself and said, I have to remove myself for a while to compose myself. So, if these are our two choices, emotional overwhelm or withdrawal, this actually is a better choice, because when we're emotionally overwhelmed, we can't do our work. So in this situation, she was able to, at least when after the patient had passed, remove herself. But oftentimes we cannot remove ourselves. So we learn instead to remove ourselves when we're still there. We become blunter, number, depersonalized. So that we're still there physically, but we're no longer really in a feeling state. So the advice given to this patient, again, it's not bad advice, and I think it's intuitively and typically what most of us learn in training. But it has limitations. It, I think, sets in motion a process of becoming numb, more numb. But I would offer a third alternative, and that is something I would call mindful presence. Mindful presence suggests the capacity to be present in the moment, in the experience that's happening, without withdrawing, while concurrently being emotionally regulated, physiologically regulated, and present, not needing to withdraw away to reduce the inputs. So where does this idea of mindful presence come from? In 1999, Ron Epstein wrote an article that he entitled Mindful Practice in the Journal of the American Medical Association. And in this article, Ron suggested that contemplative practices, such as mindfulness meditation, could be very valuable to physicians. It could help them develop this quality of mindful presence that he defined as moment-to-moment, purposeful attentiveness to one's mental processes during everyday work, with the goal of practicing with clarity and compassion. So it is about staying present in the moment, clarity and compassion. Now, over the next years, Ron and his colleague Michael Krasner at the University of Rochester developed a program for physicians where they used contemplative practice, mindfulness meditation, other practices to help physicians develop this quality. And they studied this and found very positive results. They found that the physicians who engaged in this program were more satisfied with their work, less burnt out, and more able to provide compassionate care. So it was a very promising results they got. So, okay, let's just explore a little more. How are we going to develop mindful presence? Well, analogously, if you want to have big biceps, like the woman in the top image, what you do is you go to the gym, you get weights, and you do this. And you do this over and over and over again, and predictably, no magic to it, you will get big biceps. Analogously, if you want to develop mindful presence, you'll do what the person in the lower image is doing, and that is you'll practice meditation, or at least that's one very good way to develop this quality. Now, meditation practices tend to be embedded in all of the world's great spiritual and religious and philosophical traditions. And if those traditions are meaningful to you, of course, do it. But I would suggest to you that the capacity for mindful presence is simply an extension of normal human development. There's nothing magical about it. For instance, the developmental psychologist Jean Piaget called this quality formal operational thinking. It's probably just pushing formal operational thinking a little further down the line. It's the capacity to think about thinking, the capacity for meta-awareness. So really, it's the mind of a scientist, but it's not the mind of a scientist that is, in a lab retrospectively looking at data. It's the mind of a scientist that is present moment to moment to moment, engaged, curious, interested, enlivened by what's happening. And actually, let's do something before we come to this. Some of you may be very experienced meditators. Some of you may never have meditated before. But let's do a few minutes of focused attention meditation so that perhaps you can get a felt sense of what I'm talking about here. So if you're sitting down, just, assume kind of a straight posture and back straight, shoulders slightly back, head well balanced on your shoulders, perhaps chin tucked in a bit, and if you feel comfortable with it, eyes closed. And just begin by noticing, sensing, being aware of the sensation of breathing. Notice the way the air comes in at the nose, fills the lungs on inspiration, relaxes down on expiration, and the way the belly moves with each breath. Simply locate a place in the breath stream where the breath sensation is most vivid for you. Place your attention there and hold your attention there. Now, you may have already noticed that it's not so easy to hold your attention on the breath sensation, that the mind naturally wanders, normally wanders, that you find yourself thinking. When you find this happening, simply notice, oh, I'm thinking, and escort your attention back to the sensation of breathing. And each time your mind wanders away from the breath sensation, simply escort your attention back to the sensation of breathing. Okay, now slowly open your eyes when you feel comfortable with it and bring your attention back to the presentation. What I would invite you to do first is simply right now, notice what's happening in your body. What many people will start to notice is kind of a quality of ease, of relaxation, of settling when we do this exercise. The second thing I would invite you to consider is how easy is it to pay attention for? That was about 4 minutes. If you ask somebody, can you pay attention for 4 minutes? They will say, of course I can. 1 minute, simple, easy. Until we actually try to do it. And we say, it's not so easy. Our mind is constantly wandering. It's constantly distracting from what's happening in the moment and wandering off into some automaticity. So that when we do this exercise, what we're developing is a greater and greater capacity to be in the moment, to have a settled body, a settled sort of sense of emotionality, and it comes with a clear mind as well. And when we do that, when we get better and better at that, we're much more open-hearted. We're settled in a way where compassion becomes a natural thing for us. We don't have to work at it. It's there, it's present, it's natural. As we talked about earlier, we're hardwired to be compassionate. Now, I mentioned earlier that when burnout increases, compassion goes down. It's less available. The converse is true. The more compassionate we become, the less burnt out we are. So developing some practice or set of practices that allows us to be more present, more compassionate, more in the moment with our patients reduces burnout. And I'm not saying this is the complete solution to burnout, that you can be working 100 hours a week and be compassionate. It will help you, but I would still suggest 100 hours is a bit much. So the point here is that compassion is not a zero-sum game. It helps both the receiver and the giver both. There's no loss to it. It's not as if you're depleting yourself when you're being compassionate. If we consider this within the context of what we might call relational ecology, any system, whether it's a system in nature or human relationships, there's a natural kind of give and take to it. If you're a plant, nature gives you sun and water, and you give nature back, and you give nature back flowers. If it's in a personal relationship, there's a back and forth. A relationship where it's one way, there's one giver and one taker, tends to be an unstable relationship that's not sustainable. And it's the same thing with medicine. We are asked to give a great deal to medicine. It will give back to us. If you look at studies of what physicians find helps to sustain them in their practices, it's these things: meaningful connections with their patients, making a difference in patients' lives, experiences that underscore the profound nature of life and being human. So these things, these are the rewards we get, the things we get that sustain us in medicine. The challenge is when we are numb, when we're depersonalized, when we're burnt out, this is not available to us, that we don't even feel this anymore. It's like we're going through the motions and we lose the rewards. Of this profession that has the potential for a deep sense of satisfaction. Well, okay, the last minutes we have, I wanted to segue and talk about all of us, not just doctors, and introduce the term altruism. So compassion, remember, compassion is relatively focused on suffering. I'm more empathically attuned to my patient's suffering. I desire to help. We call that compassion. Altruism is very, very similar. It's not confined to only suffering. Let's just say you're walking through, the parking lot, and there's someone trying to put something in their trunk, and you see them struggling. You go and help them. They're not suffering. They're just there's kind of a nuisance they have on their hands, but still, altruism is that desire to help anyway, right? So this is applicable no matter what we do in life, whether we're physicians or whatever field of endeavor we have. And it sort of touches on this business of self-centeredness versus selflessness. If you look at studies of this phenomenon, what you find is that self-centeredness creates fluctuating happiness. So let's just say it's time for dessert. And You go and cut the pie, and you see one piece is a little bit bigger than the other. And you think, boy, that is delicious looking pie. I want the big piece. That'll make you happy for just a moment, but it's not sustainable. On the other hand, you see the piece that's a little bit bigger of this delicious pie and think, I'm actually going to give this piece to my partner. That selfless act creates a much more authentic and durable happiness. And who knows, maybe if you're lucky, your partner will say, no, you have it, and both of you will be happy. So let's explore this a little more. This is an interesting man. He is named Matthew Ricard, and he's been called the happiest person in the world. Somewhat tongue-in-cheek, but for some reasons I'll explain to you. He's an interesting guy. He was a molecular biologist, PhD, in his young adult life. And he decided that what he was going to do is give up that career and go to Tibet and be a monk. So he's done that. He's been a Tibetan monk for many years now. There's a very interesting neuroscientist in Madison, Wisconsin named Richard Davidson. And Richard Davidson studies the neurophysiology of meditation. So he wanted in this study to look at compassion. And so he recruited a bunch of novice meditators, people who weren't skilled in meditation. And he also recruited, with the Dalai Lama's help actually, a group of very, very advanced meditators. And he wanted to look at the difference between these two groups as they did compassion meditation. So, not surprisingly at all, the advanced practitioners had very different readings on their electroencephalograms, their MRIs, because you can actually see structural changes in the brain as you meditate. Again, analogously to going to the gym and developing biceps. But Matthew Ricard, his measures were beyond the beyond, way beyond even the experienced meditators, which earned him this title as the happiest person in the world. So what we're going to have for the next few minutes, the happiest person in the world is going to tell us his secrets. So listen.
The twofold accomplishment of others' benefit and your benefit. Altruistic means that you are concerned with the other situation. You value the others, therefore you are concerned whether they are well, whether they suffer. You examine that, and if you find out that there is something that could be improved towards their well-being and happiness, or towards removing their suffering, you will have the intention to do something about that. Maybe you will not be able to do so, but your intention is altruistic. So altruism is in the motivation. And if you can, it will be, of course, followed up by action. So then, obviously, that's the best way to benefit others. And conversely, it's also the best way as a bonus, as given in addition to the others' good, that's the best way to find happiness. It's like a secondary effect, like peasants, they grow a crop of wheat or rice to feed the village, but they also get the straw. They didn't do the whole work to get the straw, but they get it as a bonus. So your own happiness will come along accomplishing the happiness of others. So be careful now. If you don't care a damn about others, but you just heard, well, by doing good to others, I'll be happy. I don't care a damn, but here, I'm giving this to this beggar. It's not going to work, because it's not just the action. The warm glow comes from being genuinely altruistic, not caring for yourself, but caring for others. Also, it's not a sacrifice. You don't have to feel miserable to be altruistic. That's so silly. I mean, precisely because actually deep satisfaction comes naturally with altruism.
Well, so there's the secret. So we're coming to the end now, and the end of this discussion about an old and underappreciated medicine, compassion, altruism. And I was invited to recommend homework to you. And so the homework I would suggest to you is, number one, remember it and administer it liberally. Do this forever, because everyone benefits, including you. So The last thought I have for you, I've been talking about meditation, and some of you may be very experienced meditators, some of you have never even thought of this. If any of you have the inclination to say, I would like to just put a toe in that water, explore a little bit how this could be beneficial to me, I could recommend a couple simple ways that you could start that process. The simplest is probably go to the App Store, find the app Headspace. It has a big orange dot. It looks kind of like a Japanese flag, except the dot is orange. Download it. It's a very nice introduction to mindfulness practice. So Headspace, the first 10 days are a nice introduction, and they're free, and you can do the first 10 days over and over and over again. Thereafter, it will ask you for a little money, a little subscription. It's not a lot. When you compare it to the cost of a Starbucks coffee, it's pretty modest. So that's one way. Another way, a more structured way, is to sign up for a course like Mindfulness-Based Stress Reduction, MBSR, Mindfulness-Based Stress Reduction. There's a couple people in the community who do this from time to time. So if you just Google Mindfulness-Based Stress Reduction Honolulu, you'll find, these courses as they're offered. It's generally about an 8-week course, very structured, very well validated as being helpful, probably about 20 hours plus of content, and it's very useful. So both of those two ways are wonderful ways to start. Thereafter, you can go a lot of different ways with it. Join a meditation group, go on retreats, whatever, but those would be good ways to start. So that's all I have for you today. It's been my privilege to be with you. I thank you very much for your attention. And I understand that we will have a period of time where we can have some dialogue, some discussion, and I look forward to engaging you there. So be well, everyone, and thank you. Bye now.